If you've been told you need genetic testing or genomic testing, you may not be sure about what that means exactly. Genetic and genomic testing are not the same thing. In short, genetic testing is focused on specific genes within your DNA that are linked to certain health conditions. Genomic testing may look at your entire genome or all of your genes to understand a more complex condition like cancer or heart disease. Before we take a closer look at each type of test, let's make sure you understand some basics. Inside the center of each of your cells is your DNA. Your DNA is broken up into packages called chromosomes. You inherit half of your chromosomes from each parent for a total of 23 pairs. Your DNA includes about 20,000 genes. Genes provide instructions to your cells to make the proteins that each part of your body needs to function properly. Any changes or mutations to these genes can result in faulty proteins. Some of these changes may be inherited. Others may be triggered by exposure to certain chemicals or caused by behaviors like smoking or alcohol consumption. Genetic testing is used to identify variations or mutations in specific genes or specific chromosomes that you've inherited. These may be associated with conditions like cystic fibrosis or sickle cell disease, where genetic testing may be used for diagnosis. Genetic testing may also be used to gauge your risk of developing certain diseases like cancer, heart disease, or Alzheimer's disease. In addition, genetic testing may be done to find out whether an unborn child has any abnormal genes or chromosomes. It's also being used now to determine how someone will react to certain medications. Before genetic testing, you'll meet with a genetic counselor who will explain the purpose of the testing and help select exactly which genes or gene panels should be tested based on your personal and family medical history. The test itself is typically done with a blood or saliva sample. When the results are back, you'll meet with the counselor again to discuss the results and possible next steps. So genetic testing is used to help make diagnoses, as well as help with decisions about screenings, preventive measures, and/or treatment options. As we mentioned earlier, genomic testing is used to look at complex diseases where multiple genes are at play. This much broader testing looks at both inherited and acquired changes in genes. Genomic testing is primarily used in cancer to learn what genes or proteins are driving the growth of a tumor and to understand how aggressive the cancer might be. This testing helps identify which treatments are most likely to benefit a patient. You may have heard this referred to as personalized medicine using targeted therapy. Genomic testing is also sometimes used to diagnose a rare or complex disorder. In research, it's used to better understand a particular disease, and it's used in place of genetic testing for more complicated cases. Genomic testing may also be called biomarker testing, tumor testing, next-generation sequencing, or molecular profiling. Genomic testing may be done with a blood sample or other bodily fluid, but often requires a tissue biopsy taken from a tumor. When you get your report, it may include information about genetic variations that you can't act on, reported as variants of uncertain significance, VUS. That's okay, because as researchers learn more about complex diseases, you will already have important details about your own genes. Ask your doctor if you have any questions about which test has been recommended for you. A public service announcement from Luminations, patient education that creates aha moments. Learn more at www.Luminations.Health. You and your doctor are a team in your care. This video is for informational purposes only and is not intended as a substitute for medical advice. Talk with your doctor to determine the right course of treatment for you.